Welcome to today's webinar, Finally, a Way to Lower Your Healthcare Cost, a case study with the City of Mesquite, Texas. I'm Katie Corder, Webinar Coordinator with Strategic Government Resources. Before we get started, I have a few housekeeping items to get out of the way. The person on your staff who registered for this webinar should have received an email with the link to download the webinar. So you should now be connected over the internet to both the audio and the visual PowerPoint presentation. If you are experiencing any problems with this file, please contact the SGR office at 817-337-8581 or at sgr@governmentresource.com. Our moderator today is Dr. Mike Mowery, Director of Leadership Development for Strategic Government Resources. Mike studied leadership for over 20 years and is experienced in guiding local governments in strategic visioning, building effective teams, and overcoming obstacles to improve and enhance organizational health. And now I'll turn the webinar over to Mike. Good afternoon, Mike.
Thanks, Katie, and thank you, my friend, for joining us today. Here at SGR, we're excited about our new webinar series, Cities on a Hill. We heard from our members that you wanted nuts and bolts case studies from the best of the best in local government, and once again, that's what we have for you today. I'm excited to be joined by two speakers today who share an innovative idea on lowering your healthcare costs. First, I would like to introduce Brian Dickerson, the Director of Human Resources and Civil Service for the City of Mesquite, Texas. Prior to joining the Mesquite team, Brian served as Regional Vice President of Government and Education Segment for Cigna Healthcare and has also served the communities of Farmers Branch and Arlington, Texas, and the State of Texas Health and Human Services Department. He has a Master's in Business Administration from the University of Nebraska, Omaha. And then also joining us today is Dr. Eric Bricker, the Chief Medical Officer of Compass Professional Health Services. Dr. Bricker is a Johns Hopkins trained internal medicine physician and has published research on the quality of diabetes care and treatment of hospital-acquired infections. So Brian and Eric, thank you so much for joining us today. And Brian, I think we're going to start with you and ask you to tell us about this great cost-saving story from the City of Mesquite.
Tell you a little bit about the city. The City of Mesquite has approximately 140,000 in it. We have 1,100 employees, and we have about 1,400 more employees who are on our health plan, their dependents. Well, we also have 160 retirees on the health plan. So we cover about 2,500 lives. One of the unique things that we have in our health plan is that we share a pharmacy and a clinic with the local school district. This has helped a lot in keeping our claims down, and as you can see that our trend for the last 6 years has only been about 3%. And our claims projected, to give you an idea, for 2013 is supposed to be about $13.5 million. A lot of what's going on in the medical community right now, and really over the last couple of years, is everybody's rolling out these new ideas. There's accountable care organizations, there's a medical home, there's all kinds of answers, it seems, to the same question, but these are very untried. And one of the ones that has been tried is a concept called consumerism, that we would turn much of the, or a good portion of the cost of someone's health care over to the individual, and they would then shop for their health care. And so in order to do that, what we did is we raised deductibles, we've raised coinsurance, we've increased cost sharing, eliminated HMOs, and installed plan designs that include health savings and reimbursement accounts. Unfortunately, there's just one problem with this, and that is that transparency just doesn't exist in the healthcare industry. There is no way for an individual call up and say, okay, how much is this procedure going to cost at Baylor and how much is it going to cost at Texas Health Resources? So that's where Compass comes in. Basically, they provide to the person information regarding the differences in cost. Now, what you're seeing on your screen right now is typical of what they would send. This is for a procedure, and it shows you that at 3 different hospitals what that procedure would cost and the individual's ultimate out-of-pocket. This is just one of the things that they do, and it's an example of what the person would actually receive.
This is, Brian, what you mean when you say there's no transparency. Outside of a company like Compass, it's not possible for an individual to see this kind of information. Is that right?
Well, that's correct. In order to get this kind of information, you actually have to know the CPT code, what's called a CPT code, that's unique to the procedure that you're having done. And without that, you're powerless to try to obtain any information. And needless to say, who would you call? Would they give you the answer? Okay?
Right.
I can tell you that when it comes to carriers, they can't disclose the information about the cost of any CPT code because they have a contract signed with the hospitals that says they won't release it. So if they're not going to release it, then I doubt if an individual can obtain this information. But our people have indicated that these estimates come back very close, and in one case, I've had a person saying that it was actually less than what they had quoted.
And when they see this kind of information, your employees, they have to feel elated and empowered to make really good decisions then.
Well, that's right. I can tell you about a story of a lady who saved $74,000 on one surgery because of the information that she received from Compass. And that's about what we pay Compass a year. So it's a fantastic organization that provides some real answers. They talk about comparing procedures. That's just what we did. They'll give you a prescription review, and maybe you have a prescription that has a generic equivalent that you didn't know about. And I've had employees come to me say they save $500 a year in prescription costs just from these reviews. And then they also do a referral. Okay, so they look through and they find the best doctors. They find the doctors that are the most efficient and effective at what they do. You can set all kinds of criteria about those doctors, how close they are to your home, whether they're male or female, and other attributes that they'll screen for you. So comparing procedures is not all that they do. And then another thing that they do is they also project, what your productivity cost savings was. Now, I've got to tell you, when we first saw this number, you had your claim savings and you have your productivity cost savings. And when I first looked at this number, I thought they're pulling something out of the air. But the more I work with my people, the more I find out the only time that they work on these issues is between 8 and 5 when they're here at work. Because that's the only time that the people that they could contact would be available. And then, how long do they spend on these issues? I would say that probably the average employee would spend at least 3 times as long as a person from Compass would spend on it because they just don't know who to contact. They don't know who to contact. They don't know what questions to ask.
And they're not doing it that often, and so by having a company that's very accustomed to doing it, you're getting their expertise. So you have great numbers here about the results that you've experienced. Talk to us about that.
Yeah, there's 3 sets of numbers here. There's this productivity savings cost, there's this cost claim savings, and there's total savings. So over 18 months, we have over $800,000 in savings by our people using Compass. So I'm getting nearly a 10-to-1 return on the value of the dollars that we're spending.
And that's way better than you would have imagined when you started to work with this company. Is that right?
Well, that's right. I mean, they told me that I would be saving that kind of money. I didn't believe them.
So this has made a big impact on your budget and enabled you to use those dollars in some other ways, right?
Well, that's right.
Well, talk to me a little bit about how have you encouraged employees to make use of this program?
Well, we've got 18 months worth of usage, and over 40% of our employees have used Compass. And the typical employer usage is much less than that. When we started this program, when I presented it to council, it was the first new program that I had presented to council. I needed this thing to work, okay, because my reputation was on the line. So we decided that we needed to come up with some unique incentives in order to promote the program and get employees to actually use it, because I felt like that once they were familiar with it and had a comfort level with it, that they would see the real value of it. 60% of our employees have utilized Compass more than once. So, and the average employee uses Compass more than 3 times. The key was engagement. So like I said, we came up with two major incentives. The first major incentive was that we give an employee a $10 gift certificate the first time the employee contacts Compass. Just call them up. All I asked them to call them, ask them about the weather, ask them anything they wanted to ask them. Then the other thing was that we said, you know, if you talk to Compass and they give you a recommendation that could save the company $500 or more, would give you a $50 gift certificate. We've passed out about 25 of those $50 gift certificates so far. We also then said, okay, we've got to really push this thing out. So it's, you know, we talk about communication all the time. We really worked with Compass on how can we push this out to employees so that you know, they would get the idea of making that first phone call and just introducing themselves. So we sent out refrigerator magnets that had their contact information, and we also sent them out to their homes, a packet with the program information. A couple of other things that we did, we invited Compass to participate in all of our open enrollment meetings, and then we gave a personal letter of thanks to employees. So the first time they use it, I send them a personal letter. Then I also send out a letter if they do save, if they are given an estimate that could save the city $500 or more, I send them a letter thanking them for using the service and how that they have helped themselves, the plan, and the city by using Compass.
So you really worked hard to engage your employees and encourage them to participate because you knew this was not only going to benefit the city, but also them.
Well, and to take it one step farther, also me. I want to make sure that I wasn't standing in front of council a year later trying to explain why we spent this money on this program that wasn't working. So, yes, all three of those. In addition, we also, as I sent these letters out, I asked them for testimonials back about their experience, and I actually got them. And we used those testimonials, we put them in our newsletter along with the employee's picture about how they saved money using Compass. And now, today, we still, on a quarterly basis, print the quarterly report from Compass in our newsletter. For those who haven't used them, they see those savings and they think, well, man, I'm going to remember to use them this next time I have something going on. We also did breakfast with HR. We had like 40-some-odd meetings where we went out to departments, bought them breakfast, and had Compass join us in those meetings and many other meetings. We'll get them to stand up and talk about their experience with Compass if they want to. This is how your average person views it, and I thought was very good, that they view it a lot like learning a foreign language, and that Compass is the one that guides them through it. And finally, this was one that actually they were going to have a procedure done, and the estimate was less than what they thought it would be.
They've done more for you than you really expected. Talk to us a little bit about some of these other services.
Yeah. So basically, the benefit that they provide is not just to the individual in my health plan. So the benefit that Compass provides is a benefit to the whole family. And all four of my family members have used Compass, even though I'm the only one who is, shall we say, officially on Compass's plan. But you know, I've even volunteered this service to my in-laws to use to help them out. So they really don't sit there and say, well, who are you? Why are you doing this? They just take care of you. Another thing that they do that we used them for uniquely was that we had a circumstance where employees were being billed for something, and we didn't want to pay for it, and the employee didn't want to pay for it. So we said, well, let's do this. Let's run them through Compass to try to get the bill down, and then the city would pay for it. And sure enough, they obtained 50, 60% reductions in some of the cost of these procedures. And then they steer to the best doctors in your network.
Well, sounds like you've had a great experience with them, and what a great case study this is, just letting us know there's hope for holding health care costs down. And I want to bring Eric, I want to bring you in now and talk to us a little bit about this company that you've got, and tell us about Compass and how do you do these things?
Well, listen, Mike, thank you so much, and thank you, Brian, as well. Compass is a healthcare consumer advocacy firm that provides tools and support for healthcare consumers. Those healthcare tools and support that we provide are in the form of price transparency, in addition to quality comparisons, because that's obviously very important when you're making decisions. And then we deliver both the price and the quality information via a consumer advocate, so sort of an assigned live person that the employees and their family members can interact with by phone or by email, so that if you look over to the graphic on the right, so that Compass is really exposing prices for members. A lot of times it's very hard to figure out what something's going to cost, really helping you anticipate costs. And then lastly, instead of just giving that information back to the employee and saying, okay, now you have to figure it out, we actually do a lot of facilitating of the savings. We really hold our hand with what we call concierge services. So we'll actually schedule appointments for people, or if you get a bill or an EOB afterwards and you don't know if you really owe that or if you don't, then we'll actually sort through those bills on your behalf. And really the point is, as it says in the middle, it's to really facilitate that win-win where it's both decrease out-of-pocket costs by the employee and then decrease overall claims costs by the plan. So the price of healthcare services is very different depending on where you receive care locally, even within network. So everyone is very, very well educated about in-network and out-of-network, but the networks are so large that even if you stay in-network, that doesn't mean that the price is the same everywhere you go. So let me give you a few examples of that. So the first one is for a CT scan, where at one in-network facility it could be $12.40 and in another in-network facility $5.27. So over a $700 difference, and this is in the same network in the same town. And you can replace CT scan with MRI or PET scan. It applies to a lot of imaging. This next example here is for GI endoscopy. So this would be like a colonoscopy or an upper endoscopy, where at one in-network facility is $25.80, at another in-network facility $5.44. And in a lot of cases, the same gastroenterologist scopes at both places. So you don't even need to necessarily change doctors, but literally where you get that endoscopy done will change the cost by over $2,000. In the case of this knee surgery, at one, so this is for a total knee replacement. At one facility, it could be $57,000. At another facility, $29,000. So literally a $28,000 difference in the same network in the same city. Both of these hospitals are actually on the same street. So literally going about a mile and a half down the road could change your cost by over $28,000. So what this is a screenshot of our internal price transparency software tool. So this is what our consumer advocates, we call them HealthPros, this is what they use to look up prices, to provide that information to the employees and their family members. And so I'm not going to go through all of these different fields, but basically this is an example of an MRI of the lumbar spine, very common for low back pain. And this is where we can look it up by the specific, look up the test by the specific CPT code. We basically sort out what they're actually getting ordered on their behalf. Down below, you can see where we can pull it up by the specific facility. Under the allowed amount, we can pull it up by the specific in-network contract rate. We can pull that up network-specific, depending upon which carrier or network that you use. And it's important to note that we're not a self-service website for employees to look up prices, sort of on purpose. We want more of that hand-holding concierge approach just to make it as easy as possible for people. Compass actually has access to literally hundreds of millions of claims nationwide that we're able to sort through with our price transparency software. So we're able to literally help folks in California and Maine and everywhere in between. And we used all of that claims data to sift through that to provide the comparative prices. In this particular instance, here are 3 in-network options for you. You can see what the different costs would be at those different places. And so at the very bottom, you'll see it says that, okay, here are your choices. Just let us know where you want to go, and we'll schedule the appointment for you. Again, we don't want to put that back in the hands of the employee. We want to make it as easy as possible for them, so we'll actually do the appointment scheduling for them. So this is an overview of our advocacy services. So as Brian mentioned, we do more than just compare costs. If you go over to the far right where it says pay, review of bills and charges, this is where, even if you haven't contacted us for price transparency for a particular procedure, we can still look through any bill or EOB on your behalf, and if we find an error, then we can actually work to resolve that billing error on your behalf as well. So then we also assist with prescriptions as well. So this is where members will send us their list of medications, in this case Crestor for high cholesterol, Effexor XR for depression and anxiety. And we'll go through and we'll see if there are any direct generic equivalents or what are considered same class clinical alternatives, and then let them know what their cost difference would be. Again, not only give this information to the member, but we'll actually, if the member wants us to, get a HIPAA authorization, contact their referring physician's office on their behalf to see if any of these alternatives are appropriate for them. Someone might be on a brand name medication for medical reasons they can't switch to the generic, and that's completely fine. We understand that. And so in those cases, we'll actually help them get signed up for mail order, or maybe they'll even qualify for a discount program through the pharmaceutical manufacturer. So there's sort of various things that we can do to lower their prescription costs. In total, on average, it's about $620 per employee per year savings. That's averaged across the entire employee population. Participation rate's about 25% of the employees over the course of the year. Compass does thorough quality screenings for all the physicians and facilities that our members go to. So we'll check the board certification accreditation. We'll look into their state medical board history to see if they've had any actions against them. We'll look to see if they've had any lawsuits in their past. You'd be surprised at what you find when you start looking into these things. Certainly, a lot of physicians have admitting privileges at 2 or 3 different facilities. And so there, if you have an established relationship with a doctor and you don't want to change, you might still have some options. And that facility charge might be several hundred or several $1,000s different, even if you use the same doctor. So there still is an opportunity for people that have an established physician that they want to stay with. One of the things that we don't do is create specific mortality rate comparisons among physicians or hospitals. Some very sophisticated academic medical centers, they might actually have higher mortality rates, not that they're bad doctors, but just because they see sicker patients, and we don't necessarily want to bias people away from those good physicians. So we're located in Dallas, Texas. All of our representatives are in the United States. So it's not like you're calling overseas or anything like that. We've been supporting clients since the summer of 2007. We support about, actually up to 1,200 employer clients across the country. A lot of our employer clients are between 100 and 1,000 employees, kind of similar to the city of Mesquite. But we have sort of large, Fortune 500 companies that have, well over 10,000 employees that we assist as well. There's also no size minimum, so we do small group too. Our health pros are all college-educated health experts. This is not a minimum wage call center employee. And then we also have native Spanish-speaking health pros as well, should there be a need for Spanish language assistance. That's a little bit about us, and I just really appreciate the opportunity to share all that information with you today. I'll turn it back over to Mike at this point.
Well, Eric, thank you so much. It's just been fascinating to hear about Compass. Thank you so much for your time. And Brian, thank you as well for sharing this great story with us. And I want to just maybe ask in closing, Brian, what's maybe the one lesson that you've learned that you would share with other municipalities that might be considering implementing this or a similar kind of program?
Many of my colleagues have shied away from some of these consumer-driven health plans because they see the savings, but they don't see employees being able to navigate the healthcare system the way that they should. So to me, Compass provides you with that medium. They're not the only answer, but to me, I think that Compass has just done a super job. They'll do as much or as little as you want them to do.
Well, once again, Brian and Eric, both of you, thank you so much. And on behalf of Ron Hollifield, founder and CEO at SGR, thank you for what you're doing. And Katie, I'm going to turn it back over to you and let you close us out.
Stay tuned to SGR's 10 and 10 for new announcements on future on-demand webinar sessions. Please remember the on-demand sessions allow your employees unlimited access to the webinar for 60 days from the date of purchase. Thank you and have a great day.